So once someone has been diagnosed with prostate cancer, and that's after a biopsy has been done, there is some controversy about whether patients that are at low risk, meaning that the prostate cancer is confined to the prostate itself, should they have a CAT scan, should they have a bone scan? So the theory is that for men that are low risk, they probably do not need to have it because the risk of the cancer spreading to other organs of the body is very, very rare at that point. We really worry about that for men that have much higher grade types of prostate cancer. So in the setting that we're talking about, it generally is not something that is needed.
Another surgery. So do you want to go to surgery? Do you want to have, there are choices even amongst surgeries. Robotic, which is the latest and the greatest, which certainly many more physicians are doing, or an open prostatectomy. And then there's radiation choices, which are many. So is it just a 3D conformal like we did many years ago, which we're mostly moving away from? IMRT, which probably jumped up 90% over a 10-year period because they feel that that's one of the better techniques for less side effects. Brachytherapies, high-dose rate brachytherapies, and certainly proton therapy, which is one of the newest on the forefront here. The simplest way of saying is the beam goes in and actually stops right at the target versus radiation therapy enters the body and goes right through. You get a certain amount, the way they configure by physics in regular radiation therapy. You're getting a dose all around the area. And the idea behind a proton is it goes into your target, say the prostate, stops right at the prostate, doesn't go through and doesn't hit any other tissue around it. There's two ways of performing that. It's really a surgical procedure, and it's putting radiation, the low dose rate is putting radiation seeds into the prostate. It's a surgical procedure. They actually enter into a needle through the perineum, through your bottom, and place these seeds. They're about the size of a grapefruit seed, and you put about 60 in, covering the whole prostate to get an equal dose of radiation all around. High dose rate is like with an iridium source. It's another inpatient procedure. It's done 3 times over a couple of day period. They put the source into the body, you lay on the table, the source emits radiation, they take the source out, and you go back to your room until you get the right amount that is prescribed by the physician.